Are we good? Bunch of, 3 thumbs ups.
Okay, very
All right. All right. That's right. It was just his presence. Right. That's right.
Yeah, we're good?
All right, come back down, Lincoln, so you're not interrupting.
Yeah, stop the views.
All right. So I get to be the fill-in, so.
I'm so sorry, but thank you.
No, that's okay. I'm glad to be able to share just for a little bit. I'm not going to, I'm going to give you guys a quick rundown on what SLPs are. As a speech language pathologist is what I do, about my certification. But I think I'm really going to hit also on who I work with, because I think that being that there's a large percentage of guys, there are some male speech language paths, but they tend to be more female. So I'm going to still give you the rundown because we've got the video going. So if anybody comes back and wants to watch, they have a little bit of information about that. And we have Megan here. I don't know if that's a therapeutic field is something you've considered, but I said to Mrs. Amos, I said, I've encouraged a lot of girls to go this route, and a lot of guys, because the therapies are a really well-paid position. I've worked as a speech path for 27 years, on and off, part-time, most of that time. But it's given me a lot of freedom because there's always a high demand in the therapies. And as our medical field continues to grow, that demand is growing even more so. I've worked both, I started out in a private practice working with traumatic brain injury, doing mostly clients with traumatic brain injury, autism, and feeding needs was where I began. Then I went from that into working in a medical setting of outpatient rehab, where I worked with everything from, I was in the pediatric side, so I worked from infants to 18-year-olds. I had infants that were born and had a hard time feeding, so they couldn't eat, so I'd do therapy with them to help them learn how to eat, while working with OTs and PTs, occupational and physical therapists. All the way up to the end spectrum in my range at that point was 18-year-olds who'd maybe had a major head injury. I had one young man that I worked with, he had been severely electrocuted, and I was just trying to, he was basically locked in, trying to work with him to be able to get a communicative yes, no, if there was enough going on mentally, because he couldn't move anything. So there's a broad spectrum of who you can work with in the therapies. It's not, a lot of the time people think it's just nursing home. You think of just geriatrics, but there's the whole pediatric side, which was what I've always been drawn to. But in the older population, I have done a lot of feeding and adult rehab when it comes to head injury. But it's nice because I work collaboratively over the years with occupational therapists who so let me backtrack. So as a speech language therapist, I would work with anything from speech, which covers like articulation, fluency, meaning somebody who stutters, somebody who has a vocal difficulty, maybe they talk like this, or like a smoker who's had vocal surgery, or they've had their vocal folds removed. Working with people to be able to speak more clearly. So that would be like the speech side. Language is people who can't understand how to use language. They don't understand what's being said to them. Maybe it's at any level. Maybe they don't understand directions. Maybe they don't understand it at a paragraph level, or just that's called receptive. Then there's expressive, like how do they use language? You guys all talk really well. No issues with that here. But, and then there's also like cognitive, which is the stuff I did with traumatic brain injuries, or maybe a person who, maybe you guys know somebody who's had a stroke and it's affected either their speech or their ability to think. So those are just a couple of the areas that an SLP works with. But we do work collaboratively. So the physical therapist would do, with those same patients, we would work maybe together. Maybe I'm working with a child who can't eat, and the physical therapist is working on trunk support. So I could work to the position for like a kid sitting in a chair, but we want people to sit up independently and have proper posture while eating, because it affects everything. So I'd work with a PT while they're working on trunk support or leg strengthening. I'd be doing the upper body, or maybe I'd be doing some speech activity or a cognitive activity, while an OT is working on fine motor stuff. So occupational therapists and physical therapists, those are phenomenal areas for you to also consider, and that tends to be more the direction a lot of the guys tend to go, more PT, OT, but there's a lot of ladies in that those fields as well. All three, the SLP, so speech language pathology, occupational therapy, and physical therapy, all really, really good fields with excellent incomes and high demand. I think that's one of the big things is we know that they're growing in need. I get pretty regularly people contacting me looking for me to take a position. It's not an uncommon thing. It used to happen weekly, but when you don't respond, eventually they quit. So, but there's a lot of demand in this field, and like I said, you can. For young ladies, it's a great field because you can have a lot of control. I've worked contracted for the schools. I've worked where I contracted independently going into homes. I did like home rehab and drove to a person's house. You have control of your hours. So for a lady who wants to be able to stay home primarily and be able to have excellent pay, for what you're doing, and you can definitely work a local job and get a minimum wage, but I can work in one day, earn what a person earns minimum wage in a week by contracting to Carmen Ainsworth. So the return is definitely worth the investment of schooling, whether it's the physical or occupational or speech therapies. So I think I kind of touched base. I guess I didn't tell you. So like. All three of these therapies, they tend to be present in the school systems. The physical therapist tends to be the ones that work heavily in the elementary schools. Occupational therapists work more in the elementary schools. By the time they're in middle school, those therapies have kind of disappeared, but the speech paths still are working with middle school and high school just because they're so ingrained with what the academic portion. But the PT and OT are very, very needed at the elementary level. So if you're somebody who likes kids, school systems are a great place to be. But there's also inpatient and outpatient rehabs. So I did inpatient rehab through Hurley and worked with kids with anything from mild to severe multiple disabilities. That would be, again, working with PT and OT. That's an area that covers from birth to 18 in the pediatrics, because and that could be from how somebody is, a problem during birth. It could be a problem during development, maybe like a child with Down syndrome. Could be that during birth there was complications. I had a good friend that I worked with for a long time. During birth, she lost oxygen. She wasn't able to breathe. The doctor was delinquent in coming and performing proper care for her. She had cerebral palsy the rest of her life, so she couldn't talk. She couldn't eat properly at birth. She had to have PT for learning how to move her legs at all, and even get enough support to sit up. She never gained a whole lot of it, but she got stronger. But it could be that kind of thing, all the way to an accident. Maybe somebody has a head injury, whether it's in a car accident, sports. There's lots of things. So covers, in that pediatric area, can cover a lot of different things. Trying to think. So hospital, rehab, schools, in and outpatient, those are like the main areas of working. Real quick, so the time to become a therapist, so like for me, I had to have my bachelor's and master's degree. It was a 4 years bachelor's degree. I took 5, but I ended up with a double major. So person going into speech language pathology would want a field that is related to communication. So I had actually a communication disorders and a psychology undergraduate degree. It could be more of social work. As long as it's people related, it would be something that would qualify for getting you into a program for a master's, which is a 2-year program in the speech path. And then there's a clinical fellowship year where you're working full-time, getting paid full-time, but you're under supervision of another speech path. So for a speech path, it takes about 7 to 8 years to get through the program. Physical therapist, somebody who's more interested in being a PT, now also requires your master's, but that typically is that 4 years of undergrad and then a 3 years master's program. And to my knowledge, I don't think they require a clinical fellowship year. So after 7 years, you're a licensed and certified. You can be a licensed certified physical therapist if you've hit all the qualifications. So it's a little bit faster, but it's a fairly rigorous, but and more medical related because you're studying the body and the muscles and how everything interacts, which I had a lot of that too, but it was all geared to communication. So it was what I studied was the brain, all the way into like the lungs and the upper body, you know, how muscles and stuff like that work for communication. I think that's about what I have. Do you guys have, you know, like I said, I highly recommend the therapeutic fields if you have any interest in like working with people, but you don't want to become like a doctor or a nurse, but you like working with people. I've liked that. I didn't share how I got into the field. So I actually went to college as an art degree major. I had done art classes in junior high and high school from 6th grade on. I had like 7 years of art. Never had a year without it, and I was going to be an artist. And I got into the art program at the college I was at, and I was like, yeah, this is so not for me. I wasn't creative enough, and when I finally started realizing, oh, I'm not going to make any money either. You know, there's no future in this. So, and it's really neat because I can kind of look back and I can see God's hand upon it, and I wasn't even a true believer at this point. You know, we know from Scripture I was already chosen by him, but I hadn't come to that understanding. But he guided me into, if I was an artist with a degree, what would I be doing to provide and help for my family at this point? Nothing. I'd be probably getting another degree or, you know, working, you know, some odd job here and there. But, you know, so go to the Lord, seek him as to where you guys belong, because he directed me. I happened my freshman year to take a communication disorder class, just kind of out of the blue, wasn't really sure about it, and I loved it. And then I realized, you know, when I found out how I was working with people, it totally fit my personality as well. So, you know, I guess my big thing would be seek the Lord in this. You know, when you're trying to make a decision, go to him, because he's the one that knows you best, and he's the one that can definitely help you make those decisions and guide and direct you, because I definitely saw, in looking back, even before I was, you know, a true believer, I can see his hand that directed me. So, you guys have any questions? Just a little. Yes. I actually worked for the School for the Deaf for a while, so I had I had one undergrad and one graduate level sign language course. It's pretty common, just because even like with a child that's developmentally not on track. So if you have a 2-year-old who's not communicating, you want them to learn. You do something, you get something. That's what communication is, you know. It meets a need. It conveys a want. So you teach them, you know, real basic, like more and please. I mean, those are like, you probably even were taught that from your mom, you know. You know, just in beginning communication, but then, yeah, and then I worked for the School for the Deaf for a year, and actually was able to take extra classes because it was required. I had to once a week take a 1-hour class with one of the deaf sign teachers, so I love that. But you also can forget it, so you don't use it, you lose it, so I've lost a lot. Any other questions? Good question. So a PT inside the elementary school, they're going to have, so like I have a caseload of about if I was full-time, I'd have a caseload of around 66 kids. So I'm guessing theirs is about the same, somewhere between 66 and 70, 80 kids. You see them to work on, so like if you're working on gross motor, maybe they can't coordinate for like hopping and skipping. Like a little kid that can't coordinate that is going to have a hard time learning to run properly. Their gait might be off and walking. So gait is like how you walk with the proper stride. You know, you see kids kind of walk with a stiffness. So they're going to work with them. A lot of the time, those are the kids that have, they're maybe on the autistic spectrum. But it could be also like a kid with cerebral palsy, like I made reference to the young lady that I worked with. But it might be somebody with cerebral palsy who's mobile, so they're not in a wheelchair like she was. where she was working on trunk support. So they might be just trying to, for her, they were trying to strengthen her abdominal and core muscles so that she could have a little bit more control. So when she's in her wheelchair, she's not doing this. So they might work with somebody severely involved for that, and to keep legs mobile and keep the muscles strong, stretching, to do a lot of stretching. But then it might be the kid that's mobile out of their wheelchair, helping them learn to walk or to use adaptive equipment. Might be maybe they use a walker or crutches, so it could be a wide range of things. And it's not always for movement. Some of it's stretching for which applies to movement, but a lot of different components, primarily like core and legs for PT. OT is typically more fine motor. And both, like PT, one of the things, I've worked with some really, really good OTs. And OTs, everybody thinks it's just fine motor, like for handwriting and pinching and eating, which are the fine motor, but they also do like sensory stuff for autistic individuals with autism, helping them learn to calm and self-regulate. And that was one of the things I really liked, was like sensory integration. We can be in this room with all this noise around us, where we just kind of know how to shut out certain sounds. Our body learns to deal with the creaking of the bench and maybe somebody sniffling, or the boiler turning on, or a fan rolling in the background. Somebody with autism can't handle all that input, and it overstimulates them and overstimulates their brain, and it just keeps rising and rising. So like OTs and PTs often do like sensory integration for them, where they learn to take that input and be able to manage it and control it and function through it. So that's a neat part of the therapeutic areas as well. It's kind of growing. That's one of the areas I really liked. I've always loved working with the severely autistic impaired individuals, but that and traumatic brain injury is a pretty cool one too. So. But that's the schools. But even private clinics do a lot of that stuff with kids too. It's a really good area to be in. I've always liked the private and the private clinic and medical field, but that's just me. So, good question. Yes. Yes.
And like my kids can attest to this. Like they're like, gosh, like it's so weird.
Yeah.
It's only been 12 weeks that you've been off of that
Right.
leg, but just like you said, your gait gets messed up because
Yes.
you've been walking awkwardly.
Yep.
And now you've got to get your gait right. So
But that's going to be more of a rehab, not a school.
Right,
The school won't be able to see that person because it's not long term and it's not impacting academic. But that would be what she's talking, like there's still a pediatric side in the rehab facilities as well. That's a great place to work with like teenagers and more elementary to teenage kids. So
all my kids have to go through that.
yeah.
It's amazing what they can do really just run on top.
Yep.
Oh, it does. Like we all have functioning brains, so it comes back quickly.
Yes.
Those that have traumatic brain injuries.
Because you're trying to, with a traumatic brain injury, you're having to not only trying to retrain the brain and the muscles, but sometimes you're having to build new neural pathways, trying to get a new area of the brain to help move. And it's not like the brain just totally takes over always, but especially in young, like I worked with a 2-year-old traumatic brain injury victim years ago, and the area that was really impacted for her, she had an area that's called the motor area, and then her language strip was really impacted, and watching her grow and learn new skills, and we knew how badly damaged that area was, so it wasn't coming from there. She was learning to function and do new things from a different area of the brain that was learning how to take over. God's made us an amazing way how our body compensates and can work through those things. So, but it's pretty cool working with. I've enjoyed it. It's been a good field. If you like working with people, it's a good area. High demand and good pay. They pay well. So, I didn't share that. So like the salary range, according to Bureau of Labor, I thought it was really high. They said it was actually for speech path. I didn't look up PTs, I apologize, but I'm guessing they're at this range or a little bit more even. Now that when I came into the field, PTs didn't have to have their master's degree. But now they do. And a lot of them are getting their doctorate So for a speech path, they range from 75 to 112,000 a year is according to Bureau of Labor. So a speech language therapy assistant, so there's also a whole different range of, so I'm a SLP, I can assess and write up a plan of care and carry it out. An assistant, they can only do what I would tell them, which I've never worked with assistants. They're not as nearly high in demand. They're out there, the field is growing, but it's kind of been really slow. But in the physical and occupational area, there's a lot of assistance. My field, it didn't really take off just because my field is very broad. It covers such a wide array of disabilities. And so it just kind of, it never took off. That assistant is really hard. But the PT and OT, there's a lot of need for assistance. So, but there's a big difference in pay because there's a big difference in education. So in my field, an assistant only makes 34 to 62,000 a year. Still not bad, especially, if you're a wife supporting, accompanying your husband's income or maybe going part-time at some point. It's still really good pay. Probably, I'm guessing around the $40 an hour range, $35 to $40 an hour range, versus, a full SLP in my field is 75 to 112. So I'm guessing PT's at least probably 80 to that low 100 range for an average, and that obviously that's not always the starting, but after you get a little bit of experience under your belt, and it's a good income, it's a good position. So
That's only mostly solutions.
yeah,
So you could go to like Mott, for instance, for a couple of years,
yeah,
get an assistant's degree, get working in the field, and then maybe take advantage of tuition reimbursement
Yep.
or something like that, and then go back and get your bachelor's degree
Yeah.
or whatever. Like it's a great place to, because there's so many options.
right. I agree.
You start out with just an assistant and you build up and
Yeah.
and then have your master's, and not accrue a lot of debt.
Right. I mean, they're all still going to require, so like I didn't even mention, so like I also had to take, coming out of grad school, I had to take like a nationwide SLP exam. And I'm assuming they also, there's what's it called? Yeah, I can't think of what the testing is called, like praxis. I wrote it down, I had to look it up. So, like give like an overview of the whole field. So they're gonna require that. And I'm assuming the assistants have to take some kind of testing, but like for SLP or SLP assistants, a lot of the times they actually require a full bachelor's degree. Some places will take you on with just the 2 years of an associate and then all the other prerequisites. But there aren't as many positions for that. Like I said, my field, it just hasn't taken off. But the PT and OT assistants, it's a great place to like Mrs. Amos was saying, to get that associates, and then you're already accruing clinical hours because you're working, so you're not having to like build up clinical hours to get into the master's program. So it's a really good way to do it. So work while you're finishing up school, and preferably young. I've considered going back for my doctorate, and I don't know. I can't imagine doing it now. So, whatever you're wanting to do it while you're young if you can. That would be my my encouragement, because it's hard to get back into school once you've been out of it for 25 years. So, but any other questions? All right. Thanks for listening, guys. Sorry if I was a little disjointed.
No, you were.
So, you're welcome.